This conference will now be recorded.
Hello, 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 party people, and welcome back to the IBS Freedom Podcast. As you can see, if you're actually seeing this with your eyeballs and not just with your ears, I am joined not just by Amy, but also by another. An RD and an RT2B. Did that make sense? It did.
Whoa, yes, it did.
Yes. So I am so excited. We have actually both talked to Molly on her YouTube channel. You should totally go check it out. But we're going to talk about GERD and reflux and acid and all of this stuff that I think becomes so freaking stressful for so many people. And we'll talk about your story a bit because Molly herself struggled with acid reflux. She is a nutritionist. She's a dietitian to be as of 2022, I believe, right? So just next year, you're going to be officially official. And I did not realize until we were preparing for this meeting that you are a yoga instructor. You were like a 500-hour certification in yoga. I did not know that about you. So it's so, so cool. You can find her with the cutest Instagram handle. She is Zucchini Who. I think it's zucchini.who actually, but you can find her on Instagram and she posts a lot of great recipes and a lot of great gut health related stuff. And her YouTube channel at the moment is Molly Pelletier. So it's her name. And you can go find her on one of those two platforms and learn more. But welcome. I'm so excited to talk to you, Molly.
Woo!
Thank you. Thank you. I'm so thrilled to be here. I absolutely adore this podcast. So thank you so much for having me.
Yeah, well,
Yes.
we're excited to get into the nitty gritty. So do you want to just launch right into telling us a little bit about your story? Like, I know that you struggled with acid reflux and you were ultimately able to manage that or overcome that with a combination of nutrition and herbs. And may I ask, is that what got you into the nutrition and dietetics field to begin with? Or did you happen to get into that and then, like, as a side, kind of worked on your reflux? Was that the initial inspiration?
So I've always loved food. I grew up loving food. My mom is a feeding specialist, which is super different than dietetics. She actually helps people learn how to eat who have functional oral disorders or disabilities who may not be able to chew and swallow. So really appreciate food. But I would say that my reflux issues were connected to actually pelvic floor dysfunction. And I know you guys have talked about that in the past. So, and which is a whole topic for another story, but I'll keep it brief and just say I was having symptoms that felt like a UTI, but they were not a UTI. So I was getting prescribed antibiotic after antibiotic for a non-UTI. And this happens, I think, all the time. So it's just another example of overprescription and overutilization. But so I was getting lots of antibiotics. And then it kind of snowballed into IBS. Reflux happened, but what there was a double whammy with that, and also my undergrad experience at Boston University. I was very stressed. I was definitely suffering from an eating disorder at the time, and it just sort of was a perfect storm to then suffer from IBS. So I think under eating, stress, then the influx of antibiotics, started having IBS, acid reflux, and I went to my GI doctor and was prescribed Omeprazole, which is very commonly prescribed for acid reflux. And it helped in the beginning, but then it started to not help, and I was pretty desperate. And I had my background in dietetics from my undergrad, but I didn't really know anything about acid reflux. So I started to do some research, learn more, because at the doctor's, my experience, I didn't get a whole lot of education on what to eat, what not to eat, what even acid reflux is, things to do in my everyday life that could prevent symptoms. So I did my own research, also had learned it in my undergrad experience, but I stumbled across a couple herbs that I had seen some literature on, and so I had nothing to lose. I was kind of miserable. So oops, my headphones are making noise. I was kind of miserable, so I decided to give it a try. I tried slippery elm, licorice root. I also tried marshmallow root. And I know you guys have spoken about these herbs in the past on your podcast, so it was amazing to actually hear that, because I think not a lot of people are aware of how powerful they can actually be. And I was really hesitant. Like, I was very aware of the placebo effect, and I wasn't very hopeful that they were going to work because there wasn't a ton of research on them. And my symptoms were so severe, like the burning, pain, nausea, really, really intense nausea. So I decided to give it a try, and they worked better than the Omeprazole. And yes, it was a huge win, and I was finally starting to get some relief. I would take them about an hour before my Omeprazole, and then at night again, about an hour or two after I would take the Omeprazole. And then with the advice of my doctor, I let him know that I was taking this, of course, and he approved it. We started to wean off of the Omeprazole. And in the past, you guys have talked about how that could be such a difficult process. So we can talk more about what that looked like. But yeah, so always talk to your doctor if you're going to wean off of a medication or take a supplement. But with his help, I slowly was able to wean off and utilize the herbs to heal from acid reflux and from GERD. So they were like such a blessing. I still take them sometimes if I have two or more glasses of wine or my trigger foods, so stuff like that. But yeah, so that's basically my story. Condensed.
Cool.
Between the misdiagnosis of the UTI, overprescribed antibiotics, overprescribed perhaps, or the prescription of the PPI, I think that unfortunately matches so much of what we've heard from our clients and patients too, where oftentimes the conventional medical world is kind of just willy-nilly, like, there's no risk in antibiotics, take them, you're golden.
Right.
And I've historically thought, oh, well, back in like the 80s and 90s when I was a kid, okay, like a child of the 80s, I kind of get it. We didn't know any better, but now we know better, guys. Like, that's so frustrating to hear. And it's interesting that it started out more as like the pelvic floor stuff and what you thought was a UTI.
It is interesting, and because IBS and pelvic floor dysfunction can sometimes go hand in hand. And I think that it really all came down to stress. Like, I was storing stress in my pelvic floor. That musculature was so tight that it felt like pain. It felt like a UTI. And then also probably had some structural issues in my gut to begin with, kind of snowballing into constipation, plus the stress, plus the undereating. So all of those things combined, it's just another reminder that there's just so many factors that go into someone's health. Like, it was so multifactorial, and so then my approach had to be very multifactorial, like really involve tons of stress relief, meditation, visualization of myself healing, and really like learning how to take care of myself in a different way.
Yeah. And I'm curious too, when did the yoga get folded into the mix? Was that after you became more aware of the pelvic floor stuff? Or was that related at all to the pelvic floor stuff? Or was it its own kind of passion that came about on its own?
I started yoga when I was 14. So before all of this happened, and I didn't have any IBS growing up, didn't have any pelvic floor issues growing up. I think that the stress triggered that. Well, the stress triggered the muscle tension, and then also the under eating. At a lower body weight, you have a lower estrogen, and low estrogen can trigger sometimes this tightening of the walls of the pelvic floor, which is why sometimes people on birth control even will get that if the dose is too low. So just an interesting side note there. But yoga was super pivotal in starting to like release some of that. I had to really like go back into my practice and utilize it for stress management, but also to just open up the pelvic floor and the muscles around it to help to release. So the lower abdomen had to really work on that too, as far as constipation. That can be very helpful. So it was definitely beneficial.
Cool. Yeah, I love that you're talking too about the like multifactorial approaches that you did, because I find that a lot of times people will go down really they'll go down one avenue very hard. Like I will go down the diet rabbit hole super hard and cut out tons of different foods. And it's like because so much energy and resources going into the diet side of things that they fail to like address stress, and the diet restrictions are causing more stress. And I tend to think that if you are gonna diversify your investments, you're gonna see a lot more of a result. But it can be hard to untangle, like if you've been restrictive and most of the focus has been on the diet, to start to ease out of that. So I love that you're kind of a good example of it took different strategies to really see benefit. I'm curious too about your visualization. I like using that with my clients, especially with food intro. I've had a few clients use it in the way that you're describing it, where it's like you almost visualize yourself getting better or like improving, or what you would do if you like were had less pain, and almost like embodying that vision, manifesting that vision. I'd be curious to know a little bit about that too, if you can share.
Sure. So meditation has always been a big part of my life since I started yoga about 10 years ago, but it was super pivotal to my healing. And so I would literally visualize myself healthy and how it would feel to be healthy, and embodying that, because I truly believe you have to believe that you are able to heal. And I know that that is so difficult for people who are having symptoms every day, struggling every day with pain and digestive dysfunction. But that is stressful in and of itself, and the body can't heal in a stressed state. And so it's so important to like have fun, pleasure, like things that are actually going to boost those happy hormones, because it's going to impact the whole system, like calming the vagus nerve and just like allowing your body to move into a more parasympathetic place is so important for healing. And so I would really just, in my meditation, like tell myself I'm healed. Like it was, I didn't even say like I am healing, like I'm healed. And so even though I knew I wasn't, it was sort of like I had to trick myself into thinking that I was. And I would picture myself healthy and like having fun and symptom free. And honestly, I think that was more important than any diet intervention that I made. And I did do the low FODMAP for a period of time because my bloating and my IBS was so severe, which was helpful because then I could see like progress. But reintroducing foods, I definitely leaned on meditation, yoga, walks, low intensity exercise, and not restricting food, and not restricting myself from going out to eat with friends or doing fun things. Like those things, it doesn't feel good to restrict yourself from. And I think people with IBS often think that it might be helping them to skip out on those things if it maybe helps them prevent symptoms. But those things are helpful for healing, having fun and doing fun things.
Right.
Yeah. And it's funny because I think people on nearly identical journeys could take totally different like approaches to what you just kind of alluded to, which is I think that somebody could be doing a low FODMAP diet, for example, or a low histamine diet or whatever it might be, and then be like, oh, I have to avoid restaurants, I have to avoid all food that I'm not making myself in order to heal. But then what is that going to do to your quality of life and your parasympathetic nervous system and your ability to heal overall? And another person might be doing an equally restricted diet, but they're like, nope, you know what? I'm going to find something on the menu I can eat. Even if there's just one item, I'm going to figure it out. Like if it's a salad with plain chicken, okay. You know, like, and I think looking back at my healing journey, I've never done low FODMAP personally, but I was doing more of like AIP for a while there. And I have to give my past self credit because I was determined enough to go out and still have a life. that that was my approach. I was like, nope, even if I have to get the most boring plain chicken salad ever, and even if there's only one menu item that I can eat, and I have to tell the waiter 3 different times, please don't glutenate me, please don't give me croutons, I'm going to go out with my friends because I'm not going to miss out on the fun. And I do think that that was probably a piece of my healing journey, because I wasn't ever willing to sacrifice going out and enjoying my life in the name of healing.
Mm. Mm-hmm. And definitely, I'm sort of cutting out like a huge piece of the journey because I was condensing the story, but I definitely swung in the opposite direction before I found what worked for me. Like I remember cutting out anything that I thought was hurting my stomach. Like I was definitely there too, where I was like, okay, had symptoms after this food, that food's out. And that really pushed me in a worse place. So I realized that that was not the best approach, to just cut out foods willy-nilly and restrict even more. So before I started leaning on these other modalities, I definitely was there. And I remember the fear of what is hurting my stomach. It has to be the food.
Yep.
I eventually realized that it was mostly the stress and mostly not eating enough calories.
Yeah. Well, and one thing too, like for anyone that is like coming from a place where they're more restrictive, I think I've been there, you've been there, I know Nikki's been there, we've all been there at some point. And I think like sometimes when I work with people, when we're trying to get out of that mindset too, it's almost being like, is this really working? Because there's like, sometimes people are so strict, and like what you're saying too, like it wasn't really working for you, the restrictions. Maybe it was blunting some symptoms, but you're still struggling with issues, it sounds like. And I think that can be sometimes a good like mental thing to take note of, is all these restrictions aren't necessarily helping me in a major way, maybe slightly. But you know, there's a different avenue that you can go down, and different avenues. It doesn't even have to be on the diet side of things that could help reduce symptoms even further. But you have to be open to that idea.
Yeah. Well, it's almost like, in a way, it can boil down to, okay, would you rather feel like crap and also have a restricted diet, or do you just want to feel like crap? And like it can be tough, especially, I think it's one thing to say that with IBS and SIBO, where the feel like crap is, I don't want to belittle it, but like it's a little less scary seeming, almost in a way. Like even if the bloating is really severe, or even if the tummy pain is severe, usually I think that's a little bit less scary versus reflux.
Yeah.
Where it feels like you have a blowtorch in
your
gut. And there can be a great deal of fear that like, oh my God, I'm doing permanent damage. I'm going to have ulcer. I'm going to have gastritis. I'm going to get Barrett's esophagus. Oh my God. So it's pretty amazing that you were able to incorporate more foods and start pulling yourself out of that hole. Because I know that reflux specifically can be really scary, because there's that, it feels higher stakes in a way, because we know that ulcers can be really dangerous, and gastritis and Barrett's esophagus could be potentially really dangerous if left unchecked.
Definitely, and I can definitely see the fear and the anxiety in the comments that I get on YouTube on some of my acid reflux videos there, and it's totally understandable that someone would feel that way. I definitely can relate to that, and I think that with acid reflux it might be a little bit different, because the triggers can be so severe. So as far as like caffeine, that was one trigger that I never was able to add back in. And so everybody is different, but it is relearning how to take care of yourself in a way, because everybody's different, and some of those triggers for acid reflux specifically can cause some immediate pain, and then that can cause anxiety, and so it is important to know what is not working for you in the area of acid reflux.
Yeah. Well, and I was going to ask at some point too, so you had mentioned trigger foods. So what did you deduce were the most relevant trigger foods for you? So caffeine, and you said to this day still a no-go for you. Does that include, I'm assuming that includes like coffee, But what about things with a lower dose of caffeine like chocolate? Are you able to tolerate small amounts of caffeine, or is it just a hard no for your body?
Um, Usually it's a hard no, but as far as chocolate, I can have it in small amounts. And that's the thing that I also speak on in on my Instagram and YouTube is that like amount is really important. So it doesn't mean you can never have cherry tomatoes again, but maybe it's a small amount, just sort of like limiting that. Like you can have the flavor, just a few, but a whole cup of cherry tomatoes may not be the best thing.
Yeah.
And with chocolate, like a small piece, like you don't have to exclude chocolate forever. But a lot of people might be okay with a small piece. But for me, taking out caffeine significantly improved my symptoms. That was a really, really big trigger. I think that it also was not great for my anxiety. Like I think I'm one of those people with the gene that just it doesn't process any coffee or caffeine well, which is tough because I love coffee. But yeah, peanut butter is also a really big trigger for me. And the interesting thing that I've been noticing that I think I mentioned this to Amy that I wanted to talk to you guys about is that people have been, I get lots of messages in emails about acid reflux people asking questions about my experience, and they're saying that their doctor gave them a low FODMAP handout and said that they should avoid the FODMAPs with acid reflux, and they don't necessarily have IBS symptoms. And that was very confusing to me because I know onions and garlic can be a trigger for some people, but I've never heard of the low FODMAP diet as like a nutrition intervention for GERD.
And that might speak to the conventional medical practices, dare I say, lack of knowledge with.
Yeah.
I was going to make a bad joke and say when you said that you hadn't heard of this diet being utilized for GERD, and even in people who don't have IBS, and I was going to chime in and say, they'll have IBS after a while on the low FODMAP diet.
Yeah.
Like that's so unnecessary for the vast majority of people. Now, if you have IBS and GERD, then maybe you could have some symptom relief on both ends from doing low FODMAP for a period of time. But yeah, that is really bizarre. I've heard more of like the low acid diet, which kind of parallels a lower histamine diet usually. So like, tomatoes, alcohol, citrus fruits, coffee, chocolate, like that's more of what I think people have come in to me with, at least, like modifying their own diet for the sake of GERD. And it sounds like that lines up more with your experience.
Definitely. Yeah, those things. I think the common triggers did ring true for me. But it's just all about amount. Like I feel like if I have also caffeine and alcohol with food is very different than caffeine and alcohol without food. So that is something to keep in mind for people struggling with those.
Yeah, and I think too, I feel like we all want very neat, like perfect. We have a neat and perfect idea of what like diet should be. Like, if I just know, like I just don't do well with FODMAPs. Like we almost want to trust and give a lot of the power to like these diets of like, okay, this is the perfect diet for me. But I think, but there's so much bio-individuality, even with something like reflux, where it's like maybe one person's reflux is really going to get revved up by tomatoes, but another is going to be fine with oranges, or like even the list that maybe a doctor would give that's more low acid and, as Nikki points out, low histamine. Like even within that context, there's going to be variability. And I love that you're pulling in that context matters of how you're eating these foods, from the amount, from what you're eating, maybe even the time of day with something like reflux too. I mean, but it does make me sad that a doctor would just be like willy-nilly with diet stuff. And I honestly wish I don't know, some people make it seem like there are, but I feel like there's not many like dietitians working with GI docs or like at a GI practice or at GI clinics. And I do think it's an area where diets can be really helpful, like diet change, doing some interventions can be very helpful at symptom reduction and just optimizing and managing symptoms that you're having. And it's a shame that doctors don't say, oh, I don't really know what the best diet would be, and hand it off to a dietitian. But instead, it's like, well, I've heard low FODMAP works for people with GI issues. Here, try low FODMAP. So it just seems, again, willy-nilly, and maybe they should be pulling in expertise from more dietitians more often.
Totally. And sort of after the fact, as I was starting to heal, I asked my doctor, just curious what he would say. And this is like totally like, he was super important.
Yeah.
He's a great guy. Doctors are in general are absolutely pivotal. But I did ask him, do you think that my diet had anything to do with this whole experience, like this whole breakdown of my health? And he said no. And I was like, really? I was like, I think I wasn't eating enough carbs or calories, just to like let him know what, like, my point of view. And he's like, I don't think that would ever cause it. And just knowing the science of under eating and motility and even just constipation and reflux and not eating enough carbs, like, definitely was a big issue.
Yeah.
Well, and I think too, now that I'm thinking about it, when we had Elena on, she said one of her bigger symptoms when she was like under eating too was reflux.
Yeah, I think you're right.
Which again, like, I don't think there's tons of data on that specifically, like where I could pull a study. Maybe we could look at like true eating disorders, but I do think like it'd be interesting to see, because it's just going to hinder most digestive capacity is going to go down if you're under eating. There's going to be hormonal changes. So it's sad that that's not necessarily acknowledged in the conventional GI space, because I think it's certainly, you saw the evidence of that when you were getting well and adding foods in and optimizing carbs and calories and things like that. But I wish it was acknowledged. And again, maybe if dietitians were in the office or something like that, there would be more focus on it. But it's a shame.
Yeah. Well, and just, I think this is a good point to point out, like, when you're working with a professional in any capacity, just kind of have some semblance of their strengths and weaknesses based on their training. Like, we know that in medical school, a lot of medical schools teach precisely 0 hours of nutrition, and the good ones will teach like a one hour class, like a one credit union or a 1 credit class, whatever.
Yes.
Like 12 hours over the course of a semester in nutrition, and that's all they get. So, it's funny because I sometimes see disclaimers made or statements made where it's like, oh, but check with your doctor before you make dietary changes. And I just laugh because I'm like, why? They don't know. Like, I mean, I guess it depends, like, what doctor you're seeing. But similarly, like, oh, check with your doctor before you start a new supplement or a new herb. Why? They don't know anything about herbs or supplements. Check with your herbalist. Or check with a naturopath or a functional doctor, maybe, because more often than not, those professions are a little bit more trained. But like, no, don't go to your primary care and ask about herbs or nutrition. They're not going to know. They might want to know, but they just didn't get that in their training. So, but if you need to ask about the side effects of a medication or whether or not you should start a medication, don't come to me, the chiropractor functional medicine person.
Right.
I mean, like, I'll try to give you my honest opinion, but like, don't come to me with those kinds of questions. Like, go to an MD or a DO or somebody who actually is licensed to prescribe. And like, to your point, Molly, when you were weaning off of the PPI, like, you kept your doctor in the loop, and it's not like you just went AWOL and decided, screw this, I'm going to stop the Omeprazole. You had that dialogue and you had that support. So if things did turn pear-shaped, you could go back to that doctor and potentially get scoped or get a different medication
Right.
or go back on the PPI. Like you had that support there if you needed it, and you had some guidance. It wasn't just like, oh, I read this on the internet on a Reddit thread. I'm gonna do this. So, give you credit
Exactly.
for that.
Right. And so he was able to guide me through that, and in that way it was very, very useful. And I'm glad I didn't just go cold turkey on the omeprazole, because that can be a total acid rebound effect, which can be really hard to recover from. People, I mean, you think you can do it, but weaning off of that, like into just 2 pills a day, maybe 1 pill a day, and it was a process of months. Taking the herbs and slowly weaning off, and like there were good days and there were bad days, but I think that eventually the omeprazole started to not be super effective because it wasn't very clear to me whether my root cause of the reflux was low stomach acid or high stomach acid. I believe it was low stomach acid, so then the omeprazole would not be helpful.
Yeah.
But yeah, in of course it was an interesting discussion because with the herbs, going to my traditional doctor because he had not heard of them, but I'm just so impressed with like how helpful they've been.
Yeah.
Yeah, I mean, a lot
Yeah.
of these herbs have a long history of traditional use. Humans have been using some of these herbs, like licorice. We humans have been using licorice for literally thousands of years. If it wasn't safe or wasn't effective, we would have given up on licorice a long time ago, but they've stood the test of time in a lot of ways.
Love it.
Yeah. Well, I'm curious to go back to the PPI story too. You said it took a couple of months. Um, did you experience a lot of rebound from that? And I was curious too, did you ever get scoped? And did they identify like any inflammation in the esophagus or gastritis or H. pylori? Was any of that involved? Or was it just like, take a PPI and they never even scoped you?
Yes, I was scoped, and a doctor can be so helpful in terms of running all the tests. So every blood test to see if I had different issues, if I was suffering from autoimmune, everything came back negative. And the scope did reveal inflammation in my esophagus, but no H. pylori, no allergies came up anywhere. Everything was so normal, which is, I think, a very common story with people with IBS, because it's like you're almost looking for that thing to be wrong, and nothing was ever out of whack. But there was some irritation. I don't think it was anything super remarkable, but some irritation in my esophagus, and then I was already on the PPI, but his advice was to continue with the PPI. I did an interview another conventional doctor on my YouTube channel, and her opinion of the PPIs is that they're never for like long term. They're never for forever. They're not intended to be a long-term medication. But I don't know if everyone gets that message that it's not forever. It seems like a lot of people are on them for years, which is, I'm not saying it's necessarily like a bad thing because everyone's situation is so different, but it's just interesting because if we're not given that information that this isn't forever and there's no exit strategy, I think that can be harmful.
Yeah. Well, and to your point, I think that not only would I say that not everybody's getting that memo, but I would argue probably 1% of GI doctors have gotten that memo, and it's just this willy-nilly, take Nexium forever, see ya. And what that happens with other drugs, it's not just the GI profession. Ambien is not supposed to be used long-term, and yet I've had many patients, and even my own mother, who wound up taking Ambien for 5, 10, 15 years. And there was no conversation of how to get off of it. So, benzodiazepines, like there are a good amount of medications that are very commonly prescribed, and people are frequently on them for long-term use, and they were never supposed to be for long-term use. That's not how they were intended to be used, and they're not safe, frankly, to be used that way. I think that goes for all three of those drugs, the PPIs, the Ambien, and benzodiazepines. I think that none of those are particularly safe to use long term, and yet the vast majority of the conventional medical field is just prescribing these like candy and not really talking to patients about the risk benefit analysis and when and how they can get off of those medications.
I know. Same thing with the antibiotics as well. Like that just being like misprescribed to me. So like I'm talking 10 or 12 rounds in a matter of 8 months.
Oh,
Oh my gosh.
And
And
nobody thought to look inside to see what was happening.
Well, and that's too like so true. You bringing it up, like I'm always shocked that docs at times don't culture stuff. Like you have a sinus infection or something or an ear issue, like at least culture to know what like is potentially at play too. Because like with sinus stuff, it could be like viral, it could be fungal, like like a lot of times if we're throwing antibiotics at stuff that it might make it 100% worse. It's such a bummer, but yeah, I'm sorry that you had to go through that. Wow.
I was really lucky to be connected with a urogynecologist, which I think is a really good person to have on your care team if you have chronic UTIs or if you have pelvic floor dysfunction, because they have that intersection of urology and gynecology. So it's really cool, again, to just piggyback off what you were saying about just seeing a specialist, because that's what they know, and no one can know everything, so you have to seek out specialists. And so I saw her, and she was able to just kind of look inside, see I was having muscle spasms, and then that was so pivotal because I was able to get help, stop taking the antibiotics, and go to a pelvic floor physical therapist, just emotionally relax, like know that I don't have a bug inside me that's trying to kill me, and then start. That was a huge moment in my healing.
Yeah, gosh, and for what it's worth, this not exactly entirely related to the gut, but might be useful for somebody out there. One herb that I have heard is very, very good for like bladder and pelvic floor like tightness or spasm and relaxing those muscles is kava. So fun fact for what it's worth, if you can get a good quality kava, that apparently can help relax that musculature pretty nicely, and it has a nice anxiolytic effect, which is what people more so use it for.
Good to know.
Apparently,
Nikki, Thomas would be proud of you.
I know. I think I actually learned it from Thomas, funny enough. So
nice.
Probably parroting something he told me. But yeah, kind of fun little fact about kava. I cannot wrap my head around so many antibiotics. Oh my gosh. I want to go back in time and give you a hug at that point, because that just sounds rough.
Yes.
And
it is tough because when your doctor tells you need this, it's like, of course, I took it all, and I didn't think to take a step back or see someone else. So eventually I did, but yeah, it was crazy.
Yeah. Well, and similar to what I said before, like being a child of the 80s, I looked back on my medical history of all the ear infections and all the antibiotics, and I was like, oh, well, of course they did that. That was back then. But I'm amazed that this still happens in the 2000s, like in the current day. Even just like 2 years ago, I went to urgent care because my mom convinced me I was dying, and I had this chronic cough, and I told the nurse practitioner no less than 3 times, look, man, like I don't want antibiotics. I have a history of IBS. I have celiac disease. I really don't need to mess with my microbiome. But I'm here for your medical opinion. If I have pneumonia, if I'm going to die, I will take the antibiotics. I just need your medical opinion. But just so you know, I'm not like seeking drugs. Because, some people probably do go into the doctor and they're like, I'm going to leave here with a prescription, damn it. And if I don't, I'm going to be so mad. I'm going to write you a Google review. And so I told the person, I don't want antibiotics. I will take them if I need them. What did they send me home with? Antibiotics. And then when I asked, oh, can I have a 1-day prescription for diflucan so I don't get a yeast infection? You would have thought I asked for 8-ball crack cocaine. The look of horror. And she was like, well, we'll have to monitor your liver enzymes. And I'm really concerned because it's not a safe drug. And I'm like, you just gave me a 10-day script for doxycycline without batting so much as one eyelash. But I asked for 1 day of diflucan, and you think that it's like the worst thing in the universe. Cut to a day or two later, I took like 1 dose of the doxy by then. And I looked at all the handouts. She gave me a bunch of handouts for viral bronchitis. I did some research. I like pulled up some videos of what the lungs sound like and what the cough sounds like. I had viral bronchitis. And the first line on their handout was, because this is a viral infection, it does not necessitate antibiotic use. And I was like, so I stopped taking the stupid antibiotics, and spoiler, I got better and I no longer have the cough. So it was fine. I did not have pneumonia apparently. But like, I don't know how much more clear I could be telling the person 3 times, if not more, I don't want antibiotics. I'll take them if I have to. So, and this was only like 3 years ago. I think it was like 2018 that happened. So apparently there's physicians in this day and age that will just prescribe you antibiotics without a second thought. And it's a shame, but we really have to be our own advocates when we go into the doctor's office or when we go to the hospital, because I think the conventional profession sometimes is on autopilot with some of these medications, and there's not quite as much thought and scrutiny as there maybe should be.
Mm-hmm. Right. And so I'm curious, when you see individuals, both of you, with acid reflux, what is kind of like your first, I know it's different with everybody, but do you often right off the bat recommend an herb, or do you try other lifestyle things before?
I pretty much will start using herbs right away. How about you, Amy?
Yeah, it depends slightly on the case, but I think trying some herbs just to calm things down and soothe things, or to help with making sure food's moving along properly, those types of things. Are you guys frozen?
No. Every now and then
Okay.
you guys freeze on me, but not for very long. And then I kind of like make the window bigger and smaller, and then it seems to be okay.
Okay.
Yeah. We're good.
I'm good.
Okay. Good. I'm frozen, so, and you guys are all frozen still, but I can hear you fine.
No, all 3 of us are moving and
Yeah, you're
looking
good on
gorgeous
my
on my
end.
end.
Okay. Well, maybe it'll normalize.
Okay. But anyway, to your point, and going back to what I had said too, I think that reflux feels like the symptoms of that burning feel urgent and scary for a lot of people. And I'm concerned, like, I don't want people to have gastritis or an ulcer or Barrett's or something scary happen. So I'm usually pretty early on, I'll jump on at least one herb. I probably start a lot of people off with just like powdered DGL to start with, and I just have them mix it with water and drink that a couple times a day. That's probably my first go-to, and the reasoning is that way, if they do have SIBO, then any sort of like FODMAP-y potential of marshmallow or Librium would probably, like, we kind of won't go there quite yet until we have more of a workup, but like the licorice isn't going to mess with anything if you do have SIBO. And then once we have a better understanding of whether or not the person has SIBO, if that is on my radar, then I may or may not move it to other herbs. But usually I'm not too worried about the potential FODMAP prebiotic capacity of those anyway. I'm usually going to try to incorporate in 1 or 2 or 3 herbs for the upper GI system while we're doing other stuff for the SIBO, whether it be antimicrobials, prokinetics, probiotics, whatever it might be.
And so another question that comes up a lot on my YouTube channel, I think that there's a lot of fear about the long-term use of PPIs in people who are struggling with acid reflux. They don't want to be on them forever.
Yeah.
But many people will ask, can I be on licorice root forever? Or can I be on these herbs? Like, are there long-term negative consequences to the herbs? And I don't respond to every single comment because I can't, but I'll say not that I know of. Like, I personally don't know, and I'm so curious. I'm curious if you guys know or have any insight on that.
Well, I can answer 2 ways, which is to say all 3 of the ones we've talked about, licorice, marshmallow, and slippery elm, are very safe. Hold on, though. I have a better way to answer. My only hesitancy would be for licorice. if you're not getting the deglycerized licorice and you're just getting straight up licorice root or licorice powder, if you have any predilection towards high blood pressure or water retention, then the licorice could exacerbate that. The effect will go away once you discontinue the licorice, but that's part of why a lot of people use the DGL version of licorice. But if you have normal or low blood pressure, you could even get plain licorice powder and use that instead and keep the glycyrrhiza in it. But with that exception, I think that all of them are pretty safe, but I'm going to double check something. Amy, you want to weigh in while I do?
Yeah, you covered all the bases that I was thinking too, with the higher blood pressure, with the licorice. That's the only thing I could think of.
Okay.
But you might know more than me, being the herbalist.
I don't know off the top of my, well, I think I do, but I want to make sure I'm being correct here. But I busted out the Botanical Safety Handbook.
Oh my gosh.
So you guys converse amongst yourselves for a moment, and I'm going to bust through
Oh
this.
Lord.
And I'll double check so that I know I'm giving the most accurate information.
Oh my gosh.
Yeah.
So in terms of the herbs that you use, Molly, like what were the ones that were the most beneficial for you?
I think that licorice root is the most potent one, in my opinion, that has helped me the most. Slippery elm, I think, is also helpful. I usually, like now, if I have symptoms, which are very mild now, and usually just because I'm honestly not very careful about the triggers anymore, I just kind of just eat chocolate when I want chocolate, and then sometimes that might give me a little bit of burning, and I try not to overdo the wine, but wine is another thing that the next day might feel a little bit of burning. But the herbs, I'll take them and it'll go away completely. Or sometimes I'll take them beforehand if I know that I'm gonna have some wine. But I'll do a combination of slippery elm and licorice root.
Mm-hmm.
And I did try marshmallow root. That did not sit well with my stomach. I just had almost immediate diarrhea.
Yeah.
So that one I didn't use. I think I also tried Gaiam Herbs makes a reflux remedy tablet. I tried that. Didn't work for me at all. I don't think the doses of the herbs are high enough.
Right. And I wonder too, sometimes with reflux, I don't know if every case is like this, but like having like a powder or a liquid might be a little bit better for certain cases, especially if there is like irritation in the esophagus or something like that. Having that liquid or powder or something mixed in liquid actually like interacting with the area instead of just being swallowed, I think is generally more helpful.
Mm-hmm. Yes, definitely. I've tried it both ways with the tablet and opening up the capsule, and I do think that there's definitely something to drinking it, and I know Nicole recommends that way.
Yeah.
That's great.
Yeah. She's like on a mission over there.
Marshmallow, if you make it as like the liquid, the cold infusion, the smell kind of reminds me of the smell of a barn, which is a good thing in my mind because I grew up on a farm, but it reminds me slightly of the smell of hay and like what a barn would smell like, but it's a little bit sweeter smelling. It's hard to describe, but it's kind of fun. So I have two, and then I will look up the third. So I was correct on both accounts so far. So marshmallow, very safe, literally no concerns identified here. So marshmallow, I think you could have at. Licorice,
I have a question about marshmallow. Is it related to the traditional marshmallow at all, or are they just
candy?
similar? Yeah, well, I don't know if is it considered candy or just like a sweet item? I don't know. But yes, like the sweet item, the marshmallow.
I don't know now that you say it. I guess I would still consider marshmallows a candy.
Okay.
But I suppose maybe not. Well, marshmallows themselves are made with like gelatin and whatnot. I've seen enough like looking at the AIP recipes. I've never tried it because it seems like a sticky mess. But yeah, I think unrelated if I had to guess.
Okay. Just checking.
Valid question.
She's asking about if these are safe. I'm asking about if they're related to marshmallows. So,
well, But you could make a similar question for licorice, because there's licorice
Oh
candy
yeah.
that does contain licorice root. So that is one and the same. So licorice, there are some more contraindications here. It seems like all of them are isolated to the glycyrrhiza compound. So if you get the deglycerized licorice products, you should be good. But for what it's worth, full-blown whole licorice root with the glycyrrhiza intact, it says not for use in persons with hypertension, duh, liver disorders, edema, so swelling, also duh, severe kidney insufficiency, low blood potassium, heart disease with edema, or congestive heart failure. So basically all of these conditions where the body is not moving fluid through, and it could be congested fluid. Any of those kind of conditions, you don't want to get whole licorice. And so you can get whole licorice herb as a powder, or like chunks of the root, or you can get the deglycerized licorice in chewables or in a powder. Licorice candy does have glycyrrhiza in it, I believe. So you have to be cautious with licorice candy as well. And there was a couple of things that noted that a couple of studies looked at licorice candy consumption by pregnant women and saw that it was heavy consumption, which they didn't find here, of the candies was associated with earlier births and adverse effects on cognitive or psychiatric development in the children. But I don't know, like, if you fall down the Google and YouTube rabbit hole, you can find some really bizarre videos of people where it's like, this man ate 5 pounds of licorice candy per day for 1 year. Here's what happened to his liver. It's like, I don't know how they define high dose. I imagine it's something absolutely absurd. So it's probably safe in moderation, and the deglycerized version is probably perfectly safe in pregnancy as well. But yeah, and then converse amongst yourselves again, and I will look up the last one, slippery elm, which I promised.
Slippery elm, yes. So what was your favorite then lifestyle hack, or even like just in general when people are coming to you? I know we talked about like meditation. Like if you're having more of a flare, or like in the past when you're more flared up, are there any sort of things that you go to lifestyle wise, like whether that's breath work or like you were saying walking before, like is there any go-to that you would tell someone to try outside of the herbs?
Definitely. I think that probably equally as important as the herbs was eating dinner early and switching the patterns of my meals. So I would have a bigger breakfast, sort of a medium-sized lunch, and then a lighter dinner, and making sure that I was getting enough food throughout the day. But eating a light dinner, super, super helpful. Eating it about 3 hours before I want to get horizontal, and avoiding big amounts of fluid in the meal as well, because that can dilute your digestive enzymes and also just cause that kind of splash of acid. So those 2 lifestyle recommendations I think are really helpful. If you have nighttime symptoms, I think that the eating dinner early is really helpful. Lots of people also swear by the elevated pillow for nighttime symptoms. I never use that, but I know that can be helpful. And yeah, I think that stress management, and some people really find it helpful to go for a walk after a meal, sort of move along the process. I personally don't find that helpful. Sometimes I think if I have a heavy meal, that I can have a little bit of heartburn if I start to move too quickly after. But I think this not overdoing dinner and sort of focusing on not small frequent meals, but overeating sometimes can be uncomfortable for people with acid reflux. So kind of finding portion sizes that work for you.
Yeah, I like the idea of adjusting meal patterns, because I think so much focus is on like, well, what not to eat and what to eat. But things like meal patterns can be really game changing from what I've seen for certain people. And it's not something I feel like that's discussed or as like sexy as like I don't know, low FODMAP or acid watchers or whatever like type of diet you're following. Like it's not as sexy as some of those food lists that we see, but I do think thinking about your meal patterns and like what you tend to do best with and maybe playing around with those can be a really interesting game-changing factor. So I'm glad that you brought that up.
Yeah. Yeah. And may I interrupt?
Yes.
I have the last and by far most interesting commentary on the 3 herbs that we were asking about related to safety. Slippery elm. Very interesting little passage that I discovered. So it's very safe also, class 1A, so you can have at it and jump for joy. But it does say slippery elm should be taken with at least 8 ounces of water or 8 ounces of liquid. So good to know. I don't think I would remember to say that. It says other drugs should be taken 1 hour prior or several hours after consuming slippery elm, as the mucilage may slow down absorption of orally administered drugs. So I wouldn't have thought of that. But it's a very valid point. It's like Metamucil. It really thickens up depending on how much water you water the stuff down with. But are you ready? This is the most interesting by far. Prepare. Drum roll, please. Amy, give me a drum roll. Thank you. Okay. Adverse events and side effects. Bladder stones have been reported in women after vaginal insertion of slippery elm bark in attempted abortions. Such events would not occur during normal oral administration of slippery elm. What the what?
Whoa!
Who is vaginally inserting slippery elm? How did that come to be?
Oh my gosh.
So,
Oh my goodness.
let it be known.
Don't do that.
You heard it here first, folks, on the IBS Freedom Podcast. Do not put slippery elm in your vagina. That's an order. Doctor's orders, for God's sake. Otherwise, oral administration should be fine. Just be mindful of when you're taking drugs or herbs, because it might bind some of that up and slow down their absorption, and drink copious amounts of liquid with your slippery elm. Otherwise, safe as can be.
Yeah, that's congruent with what I found when I started. I would take it 1 hour before my medication in the morning. I would take it first thing, wait an hour, which was hard, but I waited an hour and a half, then had my omeprazole. Then like 20 minutes later, I'd have breakfast. And then I would take the herbs again at the end of the night, probably 2 hours after I took the omeprazole, which I would take that like before dinner, my second dose.
Okay. Yeah. Sounds like you knew that. But did you know about the vaginal insertion? I bet you did not.
No, I did not.
Did you know this was the experience you were bargaining for when you volunteered to be on the podcast?
And now you have another disclaimer to tell people about slippery elm.
See, you can comment back with your YouTube comments and be like, well, here's something you need to know, my friend.
I love it. Yeah, no, that's great.
That's the most unique thing I've ever read in that book. Usually this book is pretty dry.
Yeah.
Quite honest, but that was very fascinating. Also, on the topic of weird vaginally inserted items, we're going to go down this road now.
Whoa, okay.
Not about my vagina. Get your head out of the gutter. But listen to this. So a friend of a friend who is, I believe, an ER physician or maybe an OBGYN, once told my friend Otra that in her work, I think it's no secret that ER doctors oftentimes will have situations where peculiar things are inserted anally and then they have to retrieve said item. So if you guys ever watched Scrubs, there was an episode where somebody put a light bulb in his butt and then they had to try to get the light bulb out without shattering it. Have you guys seen this episode? It's classic.
No.
And then the janitor ended up helping Dr. Cox somehow.
Oh my gosh.
Anyway, so similarly, sometimes unique things get put in the vagina. And this doctor had mentioned that one time she saw a patient who was having uterine prolapse issues, right? So she wanted to keep her uterus inside her body. So her solution, I kid you not, was to put a potato up her vagina. And fun fact, potatoes are root vegetables. So what do they enjoy? They enjoy dark, moist environments. The potato started to sprout.
Oh my gosh.
Sprouting and growing roots and growing vines, and it was searching for the sunlight. How did this happen? And how long did this lady have a potato in her vagina? How was this happening on planet Earth in this day and age. I'm so boggled. Like, okay, if you were alive in like the medieval times and you didn't have modern medicine, then all right, put a potato up your vagina. I don't know. Like,
Right.
sure, why not?
Right.
But in the 20th century or 21st century, like, how did this come to be? Did this woman Google it? I don't even know.
Right.
So also, doctor's orders: do not put potatoes up your vaginas either, people.
Yes.
So the two biggest takeaways, obviously, from this episode: don't put potatoes up your vagina. Don't put slippery elm up your vagina. All the rest of it is your business, but that's like
That's the bar.
The bare minimum, if you can get that out of this episode.
Right.
Hopefully we taught you more than that.
Where do we even go from here?
I honestly don't know. Potatoes. Can you have potatoes or any carbohydrates ever either triggered reflux for you, or have they soothed? Because I can imagine, I was thinking about it in my herb hunt over here, and I don't know why it popped in my head, but I imagine that something like oatmeal that's like a bit, thick and kind of sticky, like I could see that being potentially soothing for reflux. Saying that as a person who's never had reflux personally. Have you ever noticed any foods that were particularly soothing for your reflux, or like any, complex carbohydrates or atypical foods that would trigger symptoms for you?
That's a really good question. I have not noticed specific foods that have soothed reflux, but I will say the absence of carbohydrates triggers reflux. I'm not exactly sure if it's like a long-term like carbohydrate restriction, or just even if I had, say, a salad with a glass of wine. I'm making myself sound like I drink wine all the time. I maybe have it once a week, but
would it make you feel better if I got out a chocolate bar and like started? I can make you look real good real quick.
But like, if I was having acid reflux for any old reason and just had a salad, I would notice my symptoms would feel worse or just not better after. But having like a mixed meal with protein, with carbohydrates, something that can kind of absorb some of the acid in your stomach and give your stomach acid something to use or to work with, I think that's really helpful. So meals that are lacking protein and carbohydrates, I think definitely would not help my symptoms. And then, but oatmeal is, I think, very helpful in terms of something soothing. So some other videos that I've been doing recently is full day of eating with acid reflux on my YouTube channel. So, and I always give the disclaimer that I am not prescribing a diet or anything like that, but I'm just showing you what I would eat if I was having a flare, or what I used to eat when I couldn't have any citrus, any tomatoes, stuff like that. And I just give sort of ideas like vinegar-free dressings, how to make those, and some breakfast ideas and meal ideas that are sans reflux triggers. So one of the things I did make in a video was some overnight oats with chia seeds and protein, and that I think is a really easy thing, a really good meal idea, because people with acid reflux and GERD do really struggle with what to eat. Even though the list of reflux triggers is not super extensive, it can be tricky. So I think oatmeal is a great go-to. Complex carbohydrates, proteins, stuff like that is very useful and generally very reflux friendly.
Yeah, I wonder too, like, if you're cutting out like carbs as well, like if you're going more of a keto route, if like higher fat could also affect reflux in certain cases. I don't think it will in every case, but like even just because you're cutting out one macro, you have to sort of add another macro, fat, to help get you the calories that you need. I wonder if that could sometimes. What do you say, Nikki?
I said, if you want to live.
Right, if you want to live and not
all your macros and just keel over. But
yes, well, don't do that. That's the other thing. Don't do what Nikki's saying. Yes, and then, but I think again, I wonder if there could have been like a macro component too, if you were kind of heavily focusing on fats or something compared to having more carbs.
100%. I think that that's definitely true, especially because carbs and proteins will move through your digestion quicker than fats, and that
Mhm.
if I had a meal that was very high in fat, um, I noticed it would stay in my stomach longer, which isn't necessarily a bad thing, but if you're having acid reflux, that can be uncomfortable, and you kind of want things to be moving through at a good rate. So having a moderate amount of fat, but not overdoing it, and including those other
Yeah.
macronutrients is helpful.
Yeah.
Yeah.
No, totally.
Yeah, and I was gonna say that too, that fat does, I don't, I want to throw this around willy-nilly, but it delays stomach emptying
Mhm.
more so than the other macros.
Mhm.
So, theoretically, if you had somebody with GERD who also didn't realize they had like borderline or undiagnosed gastroparesis, right? Like if somebody has a situation where
Right.
delayed stomach emptying is already a piece of what's going on for them, and then they try to do keto and they're delaying their stomach emptying even further, then that could
Right.
potentially not be so hot. If you have another person who just has GERD and it's more isolated to, like lower esophageal sphincter tone or like other things, but they don't have delayed stomach emptying or borderline or subclinical delayed stomach emptying, then maybe the fat wouldn't have as much of a deleterious effect. And I know like one patient, I don't remember exactly, but she had had a stomach emptying test done. And I just remember it because she had looked at the notes that the doctor provided afterwards, and she was concerned about it because like whatever the numbers were, I don't remember if it's like minutes or percentages, whatever it was, but like the cutoff for the diagnosis of gastroparesis was like 15, and she was like 14 or 15, but they told her she didn't have gastroparesis, and she was like, ah, like I don't know, doesn't that seem like it could be really relevant? So yeah, even I think that some people with delayed stomach emptying or like slower than normal stomach emptying, which inherently is a dysmotility disorder, which is another story for another day. I think that those people would probably see more of an issue with high fat meals as opposed to somebody with just reflux and not as much of a delayed stomach emptying issue,
Yeah.
theoretically.
It's a great point.
Yep. Well,
Mhm.
guys, I don't know. I think my brain is full of cool new information. Weird combination of about the stomach and the vagina now, but I'm going to take it for what it is.
This
Um,
podcast started with the vagina and ended with
Yes. Yes.
that's how we do over here at the IBS
Yes.
podcast. You would never
Yes.
know that it was such a vag heavy episode. Sorry, boys. This one's for the ladies.
You're right.
Amy, do you have any more questions that we can grill Molly with, or
I
I feel
don't
like we've covered
I
a lot
don't
of
think
bases?
we did. I'm thinking that we actually do need to do like a vaginal microbiome episode or something like that.
We
Would
shall.
be We shall do that at some point.
Yeah, I mean,
But
1 in 4 women have pelvic floor dysfunction, and there's a huge spectrum of PVD. So if you ever want to chat more about it, I'm no expert, but it is really interesting to hear other people's stories with it because it's just something people don't talk about. So it's kind of cool that
right.
we were able to talk about it.
Yeah.
Yeah. Do you have any like if you're just since we're here, if you had someone that was struggling with pelvic floor disorder, maybe they comment on your YouTube or you just have a friend or like anyone who's struggling who might suspect they have an issue, what would be like the first steps to take?
Mm. I would see a urologist. Gynecologists may not know a lot about it.
Hmm.
If you're having pain with like tampon insertion, pain with sex, like that's not actually normal, and don't let anyone tell you that's normal. And I would go to a pelvic floor physical therapist. Um, if you're having just like constant like itching, burning, cramping, but you don't have an infection that has been ruled out by a doctor, you may have pelvic floor dysfunction. That's a specific type of pelvic floor dysfunction that is actually really common. Um, And yeah, if you just feel like, or incontinence, like if you have to go to the bathroom a lot, you wake up more than a couple times a night. If you feel like the muscles are weaker, like all these things can happen. And I mean, there's the whole other spectrum too with like after childbirth. That's like one area of pelvic floor dysfunction, but you can have it at any age. And it's just so, yeah, it's just people don't talk about it enough. And it does, so many people with IBS and SIBO also have pelvic floor dysfunction. And I learned this through podcasts because I found this whole community of pelvic floor dysfunction, and there were people with SIBO and pelvic floor dysfunction, and there's a whole group there that chat about it. And it's really interesting because I think there's something about the nerves in the stomach are also innervated or connected to the pelvic floor. So if you have IBS related to like vagal nerve tone or something, an issue with the vagus nerve, you may also have like a pelvic floor issue where you're clenching, and then that can lead to other issues. So really interesting connection there.
I saw a study not that long ago, because actually a patient of mine, or a former patient, I helped her years ago, but she reached out after one of my like email news blasts went out, and she said, "Hey, I just thought I wanted to let you know I was struggling with some constipation, but it wasn't SIBO-y, like it wasn't like it was before, and my doctor referred me to a pelvic floor PT, completely resolved the issue. It was miraculous. Just wanted to let you know if that wasn't on your radar." And I actually didn't realize that pelvic floor dysfunction could manifest as constipation. And she had said she didn't really have a lot of the vaginal or urinary symptoms. It really was almost purely constipation for her. So it was really interesting. I'm kind of looking more into that. But I saw a study after I talked to her a little bit that like they took a group of constipated women, had them do pelvic floor PT, and it was something like 60 or 66% of those women found relief from their constipation doing pelvic floor PT, which is crazy. Like that's such a high success rate for something that was not even on my radar until a few months ago. So pretty profound stuff. I will share my plot with you. I have been creeping on Instagram, and I've been looking for a pelvic floor physical therapist who seems to know about the pelvic floor constipation link. And I've been looking for somebody to invite on this here podcast. So I have yet to find the one. I'm creeping on several right now. They seem to talk more about vaginal related stuff, and maybe we'll end up talking about both. But that's in the works in the future with people. I just have to find the one. And we'll talk all about pelvic floor PT with somebody who's in that field. I think that could be really cool.
Yeah, I can't wait for that one.
Yeah. Well, rock on. I think this is good stuff. I think a lot of stuff to chew on. Again, I really appreciate not only just your willingness to talk about your own journey and your symptoms and like what worked for you, it just like your perspective of being able to look back and say, gosh, I think under eating was a big contributor. I think stress was a contributor. And I give you a lot of credit for like figuring that out and kind of navigating that and overcoming a lot of what you did. So yeah, just thank you for sharing your story and your expertise and what helped. And like I said, guys, I mean, she's got boatloads of good stuff on her Instagram page, Zucchini, and on her YouTube page, which is her own name. So that's easy enough to go find, Molly Pelletier. So I really hope that people go check out all of your resources. I don't know, guys. I think that's a wrap.
Yeah. Thanks so much for coming on, Molly. This was awesome.
Yeah.
Thank you so much for having me. I'm so honored to be here. And I love that your approach and how you do focus on stress management and liberating the diet and sort of taking a multifactorial approach. So I'm really honored to have been a guest. Thank you so much.
Yes, of course.
Yay, thank you. Well, guys, you know the drill, but I'm going to say it anyway. As always, if you're on one of those newfangled podcasting apps like iTunes, if you could give us a 5-star review, that would mean so much to us. And if you are in any of those online SIBO groups and Facebook groups about IBS and gut health and candida, if you could share this somewhere, even heck, if you're in any GERD or reflux related Facebook groups, pop this link in there and get this information to the people who need it most. I know that I would deeply appreciate it, and I'm sure these guys would as well. And if you're on YouTube, you can click like, ring the bell, do the comment thing, subscribe, please. and that will also help us reach more people. And the YouTube gods will favorably look upon us and show our stuff to more people if you subscribe to the channel. So thank you so much. And as always, leave comments and questions down below, and we will tackle those in the Q&A episodes as we do those. So thank you all for tuning in. Molly, thank you so much for coming on the podcast. It was such a pleasure, and hopefully we will talk soon.
Sounds great.